in general, I mean, caring for patients, whether or not they have COVID, is kind of the same either way. Just this, specific things that are unique is just much more, a lot more usage of PPE, and definitely with patients who we consider to be high risk for having COVID or who actually are confirmed COVID, just really clustering our cares and spending less time in the room, less frequent trips in and out of the room, and just making sure that we can kind of minimize the entrances and exits of the room just to minimize exposure to everyone else who other patients in the ED who we still see who are, not being tested for COVID, who are here for something else. Something that like this that's quite infectious that a lot of people have or could have, it does kind of change how we mentally prepare. Just, okay, I'm going to be going into this room, one time, I'm going to try to get everything I need, or I'm going to, make sure I cluster all my cares and make sure I can, minimize the trips in and out of the room. There's been infants to very elderly and people everywhere in between, and people who are, not affected at all, and people who are, quite affected by it, who are otherwise healthy. So it's a very wide spectrum that, there's nothing we can predict of how someone will be affected. Having come into this, several months, we've kind of been told what to expect, and, we're starting to feel that. But, leadership in the ED and the hospital has been very good about, making sure everyone's doing okay and making sure everyone has the resources they need, both internally at work and like externally if, they're feeling overwhelmed to kind of cope with it. They're, very good about checking in with that and making sure that we are, taking care of ourselves. Feel like I'm coping about as well as I can. I, work like we've been, prepped on what to expect. And when I'm not at work, I make sure that I'm, doing things to both de-stress and kind of enjoy myself, whether that be go on a walk or a hike or working out or a bike ride, or now that it's colder, doing that inside. But just making sure that I'm, spending time doing things that I enjoy, that rejuvenate me and just, make me feel prepared to go to work again. Not that it's like a burden, but it's just, if it is getting, like, we know that it could get worse, and it's just kind of, making sure that, okay, like, we're going to be ready, and I'm taking care of myself at home. And if that ever happens, and even now, as things do get busier. There's been several instances, when a patient does come in who is confirmed COVID positive and they are quite sick, to minimize exposure to everyone else in the ED and to other nurses. What often happens is that, that nurse is wearing full PPE, and they kind of like I touched on before, minimize going in and out of the room. What will often happen is they will have other, staff kind of team up to prepare everything and hand it to the nurse inside the room as the orders come through and as situation changes over the course of getting that patient settled in, just to make sure that nurse have to keep coming and going and, risking exposure every time we open the door, that they come out and have to put on PPE again. So it's, there have been many cases where, I've prepped meds and prepared medications and gotten supplies multiple times for many nurses who have been in these COVID positive patients' rooms to make it so that they don't have to keep coming back in and out again for the sake of everyone. Please wear your mask, please social distance, and just be mindful that, it doesn't discriminate, young, old, it affects everyone. Even if you think you're young and healthy, that doesn't matter. We're doing the best we can in the situation, and we'll keep doing it.
It really does change on an hourly basis. There are days where, literally, we can start the day and have no beds available, and then by the end of the day have 5 beds available. It really varies. And especially because really most of our COVID patients come in through the ER. That's, typically where they come. And so from there, again, depending on the severity of symptoms and things, we make the appropriate care choices for, them, which doesn't always mean being admitted, So, and our capacity obviously has so much to do with non-COVID as well.
Sure.
So it really varies. But as he noted, the nice thing is that we do have access to our other SSM hospitals and resources, as well as, if those are full, we can always reach out to other hospitals as well. And, and the other thing is we work with nursing homes as well, because there's a fair amount of our patients that are, of an age group, or, maybe we work with them not just for COVID, but just also for, say someone was having a surgery and now they need to go to a short-term care facility for rehabilitation. So there's a lot of different things all going on at once. It's hard to say it's just COVID, right? I think is kind of my point that, every day in a hospital, you're caring for everyone in all different kinds of situations. So they have very specific requirements around what constitutes, a COVID room. And one of the main things is a negative airflow room. And so that's why these are very specific rooms for the most severe. I mean, these are rooms meant for someone who's having very severe COVID symptoms and need to be in a negative airflow room. Obviously, we do have people that come in asymptomatic for COVID. They test positive, but they go home. They don't get admitted. They just go home. They quarantine. They, do the prescriptions that are, sent home with them, whatever that may be. So far we haven't been in a situation where we, could not care for a patient, in the fact that we have so many resources, both internally here at St. Clare and within our SSM Health system. And then, like I said, if we need to reach out to other hospitals as well. And that's a reciprocal partnership. Other hospitals, if they, reach capacity and need to reach out to us, they will as well. So, it's not a one-way street, it's a two-way street. It's that whole, we're all in this together, right? And everyone's trying to help everyone, because really at the end of the day, our goal is to always be able to, it doesn't matter if there's a pandemic or no pandemic, our goal is to provide safe, compassionate, exceptional care for anyone that comes through our doors. So at the end of the day, that's what drives everything we do all day long. We have a full surge plan in place, as does every other hospital. So right now we're all just kind of operating non-surge plan, and we don't need to be in a surge plan, and that's fantastic. That's ideal.
Right.
So fundamentally, you hope that you never exceed your, surge plan. That would be, things would have to be really, really crazy in the universe for that to happen. We're operating at pretty, normal capacity. Again, it ebbs and flows daily. We're doing outpatient surgeries. We're doing inpatient surgeries. We're, all of our normal hospital functions are still happening. We don't have any, anything like our cancer care patients are still coming in for their treatments. So, overall things are, pretty average, I would say. And that just sort of adds a layer on top of what we're doing anyway, because we're still at our clinics. We still have people coming in to see their providers for, whether it's a well child or your annual exam or, all of your regular maintenance care that you want to make sure you're still getting, so that, during the pandemic, you don't want to, say, oh, I'm going to wait to go in, because that's unfortunately where things can, spiral into bigger things. And so we are definitely still providing all of our standard, services. So we have access to a very large, supply of PPE, and have not had any challenges being able to get what we needed for PPE. We have enough staff here for our normal operations. And as I noted, we monitor our staff levels daily. We have done some cross-training of staff to kind of prepare, as you noted, for, okay, if, what if in the future. So we've done some cross-training with our staff, which will help, keep us where we need to be for staffing levels, because people are able to kind of shift around a little bit more. As well as we also have access to a regional labor pool. So if for some reason we were short some employees, we have a larger group that we can reach out to and bring people in as needed.
I assume that's not something you've had to do yet?
No, we in general have not. We've been able to cover for the most part with our own staff. I think as a community at large, everyone, we're aware that obviously COVID has been hard for everyone. Doesn't matter, where you are, and everyone is a little burnt out and tired of COVID.
Mm-hmm.
And we understand that. We also, though, I think have seen for Sauk County that, in our community, that really everyone seems to be doing a pretty good job of trying to follow the health recommendations and all of the information that Sauk County is putting out, to keep the community healthy and safe and minimize spread. So we've been very fortunate, I think, in that there are a lot of other counties in a whole lot worse shape than we are in Sauk.
Mm-hmm.
We obviously share information with, other SSM hospitals in other counties, and we are faring quite well here compared to some other counties. And we're, very grateful for that. And I think a large part of that is that our community does care, and they're really trying to adhere to all of the guidelines around masking and social distancing, washing our hands, staying home as much as we can, not, being out more than we need to be, utilizing online resources.
I know the Sauk County Health Department did, I think last week, send out a press release about, outbreaks occurring at weddings that people were holding. And I know, bars and stuff like that are still open and have
Right.
people coming in. Are you at all concerned about those kinds of activities?
Again, this is where we hope people are using good judgment. It kind of goes back to that we understand everyone just wants our life to return to normal, right? We miss people, we want to socialize, that's the nature of being a human. We want our connections with our people, our friends, our family, our neighbors, whoever that may be. So I completely understand that people want to celebrate weddings and, all of the things that we are used to being able to do. I think people are getting creative and trying to work around kind of this new way of living where we're still trying to stay connected but stay safe. And I know everyone's tired of putting things on hold,
Mm-hmm.
but we hope everyone can just, still find a way to celebrate but be creative, right? The biggest thing is we just want, beyond all of the, basic guidelines that, everyone's promoting for safety. We just want people to know that we are here, we're providing safe, compassionate care, just like we always do. Whether a patient is COVID or non-COVID, we're going to provide the same level of care, specific to what they're coming in to be seen for. And we definitely want people to know that, we are fully staffed. We have capacity. We're providing safe care, and we have a plan in place should things continue to rise and escalate. So our goal is to, COVID or no COVID, our goal is just to provide, this care for our community, our family, our friends, our neighbors. With flu coming on top of COVID, let's all just be extra safe and have our flu shots. Even if you don't normally get one, this might be the year to consider it.